welcome to ACC's interviews. I'm Eva and I'm here with Danielle Luchene to talk about her career as a nurse. So to start off with, what inspired you to be a nurse?
Ever since I was little, my two aunts were nurses, and I used to, hear stories from them, and they would come home and just talk about their experiences, and I was really drawn to helping people. And then when my second daughter was born later on in life, she was born early, had a lot of medical issues, and was in the NICU, and I was I was amazed at how well the nurses took care of her, and I wanted to be a part of that.
Yeah. So what were some of your responsibilities as a nurse?
Well, being a nurse is it's very challenging, but it's also very, very rewarding. Um, you receive a shift report at the beginning of the shift. You're learning about your patients from the outgoing shift, and then you have to look up labs and communicate with the doctors about some of those labs, pass medications, start IVs, respond to a rapid response if you need to, which is where a patient is declining, or a code blue. There's a lot of different things that are that it takes to entail, to be a nurse.
So if you can, what were some of the codes that you guys would have to go through?
Code blues, that is when someone stops breathing and their heart stops, and you have to perform CPR on them. There's different codes for different hospitals. There's code red, which is a fire. There's certain protocols that you have to do. Code silver, I think that is a missing persons. There's also something called a rapid response, or an acute response team, which is where you have a patient, let's say, that's having a seizure. So not necessarily CPR is needed, but you need all hands on deck. You need people to come and administer medications, and you need the doctors there. So it's actually a very helpful system.
Where did you go to school to be a nurse?
I went to the University of St. Francis in Crown Point for nursing, which is it's a really, really good program.
How long does it typically take for someone to become a nurse?
So you can do a 2-year degree, which is an associate's in nursing, or you can do your bachelor's. I would recommend at least doing a bachelor's, but really, once you earn your associate's degree and you go on to your bachelor's, that's more, you're learning more about charge nurse duties and, not necessarily becoming a manager, but kind of higher on that food chain.
What was your favorite part of being a nurse?
My favorite part of being a nurse? I would have to say the interaction and the ability to help somebody when they're at their most vulnerable state. Patients are in the hospital. In my case, they're sick, they're scared, they're being diagnosed with different things, or they're having pain crisis, and you are their go-to. You are there to help them and to help them in their recovery, help give information. Patient teaching is super important, but I think it's just being able to be that soundboard for them, being able to really make that difference.
Yeah, so you just you find pleasure in helping people out and just being there for people.
I do. I'm very much I very much have a helping personality. I've been told that I was born a healer. I'm not sure how true that is, but I like love. I like light. I love positivity and encouragement, and being non-judgmental and just, you know, accepting people for who they are and where they are.
Yeah, nurses are like really, like truly, like some of the most amazing people.
Well, thank you. Thank you.
What was your least favorite part about being a nurse? Because everything has their cons.
Probably my least favorite part of being a nurse was when I was the assistant manager on my floor. It became less and less about patient care and more about kind of telling people what to do. And I certainly didn't go to nursing school to learn how to tell people what to do, right?
Yeah.
I went to help people and to, you know, help people feel better. And so that was a little, you know, very nerve-wracking, you know, having to do schedules and time cards and, you know, OT, make sure people had their overtime pay and different codes in the system. You know, you had to take call-offs and you had to fill in and, you know, that's, you know, I'm not really interested in that part of nursing, you know. I'm more into the, you know, bedside.
Yeah, so like what you did was more so like dealing with everybody that did the stuff you wanted to do.
Correct, yeah. Pretty much.
So what was it like as a nurse during COVID?
That was scary, very scary. I actually worked on a med-surg tele floor, and we ended up becoming the COVID unit of our hospital, and one of them. And yeah, that time was very, you know, scary because it was so unknown. You know, we were constantly changing protocols and, you know, different PPE and negative pressure rooms and, you know, where to place patients and symptoms and, you know, learning about the different treatment modalities. And, you know, it was scary. I saw a lot of people die. You know, I kind of made it a point that I would sit with patients when I knew that they were dying because I couldn't have family in the room. They, you know, we didn't allow visitors. And I just, you know, I just didn't want them to die alone.
Yeah, that must have been so hard to go through.
It was. You know, there's a lot of hiding in the bathroom and crying and putting water on your face, and then, you know, you get up and you put your big girl pants on and you just, you know, continue on. You know, I think my favorite part of the day during that time was my car ride home because it was, you know, I wouldn't put my music on. It was just silent, and I needed that. You know, I needed that to regroup.
So what skills are like generally like needed to be a nurse?
Well, I would say probably one of the most important skills in being a nurse is the ability to critically think, because really a nurse is the doctor's eyes. You know, the doctors aren't always there. You know, they spend a few minutes at the bedside, but you're literally with these patients, you know, your whole shift, 12 hours. And so you have to be able to critically think. You know, if you have a patient with, you know, an abnormal lab, you know, and, you know, you need to make sure that that doctor is you know, you need to make sure that you contact that doctor. If, let's say, their white blood cells, you know, raise up, you know, they're going to need some antibiotics. So, yeah, critically thinking, I would say, is probably the most important.
Yeah.
Probably the other one, too, is the ability to really listen. You know, I find that when I'm in a patient's room and they're talking to me, sometimes they just need you to listen.
Yeah.
You know.
Well, that's all we have for today. Thank you for joining me, and that's all we have for ACC interviews.